In this chat GPT era, digital advancements are reshaping healthcare, including vision assessment. As web-based tools become more prevalent, ensuring their accuracy is crucial. Good morning. Today, I, Dr. Drishti Singh, will be talking on the influence of computer parameters on contrast sensitivity values obtained with the web-based space enrichment contrast sensitivity test. As we all know, contrast sensitivity is the ability to perceive slight changes in regions not separated by definite borders. In measuring contrast sensitivity, we have come a long way from grading charts to letter charts, and now mobile and computer-based applications like Sparks. Sparks is a web-based contrast sensitivity test that can be accessed via the following URL. Here, the patient gets a unique identification number. It is based on gratings and is independent of the effects of literacy. It measures both central and peripheral contrast sensitivity. It measures a wide range of contrast and uses a bracketing technique. Here, the patient is seated 50 centimeters from the computer monitor. It has 4 peripheral quadrants and a central square, with each square having a score of 20, amounting to a total score of 100. So why the current study? There is increasing amount of literature making use of Sparks and many other web-based applications. Therefore, it is important to consider the influence of various devices and validate them. Therefore, our objective was to see the influence of 2 different laptops, that is MacBook and Surface Pro, on contrast sensitivity values obtained using Sparks. Our study was a prospective observational study that involved 80 healthy individuals free of ocular diseases. The age group was from 18 to 40 years of either gender, with a visual acuity of 6.6 in both the eyes. The exclusion criteria included the use of contact lens or dry eyes, history of any incisional or laser eye surgery in the past 3 months, and any other cause of visual impairment. The testing was done for each patient on both the laptops using a calibrated laptop screen. It was done uniocularly. 1 demonstration and a practice trial was done. The participant was given a break of 5 to 15 minutes after the practice test. Order of testing was randomized. At least an hour's gap was given between the testing with different laptops. Testing was conducted in a room with fluorescent lighting with no windows. This is a representative case of a 20-year-old male on both MacBook Air and Surface Pro, showing us the different total scores and different values for quadrant-wise score. Coming to the result, data of 160 eyes were evaluated of 80 subjects with an average age of 26 years. Non-parametric tests were employed to examine the correlation between the 2 variables. A moderate to strong correlation was found between the internal components of Sparks and with the total Sparks score when performed on the same laptop. However, between 2 devices, the correlation coefficient was weak. Therefore, while the mean difference was small, broad limits of agreement and moderate correlation suggest using the same device for consistent measurement. Therefore, Sparks on a single laptop and the same browser can be used reliably and consistently to know and compare the results. But to ensure comparable results using Sparks on different laptops, it is important to consider the specific display properties of the 2 laptops. These are the few parameters that could have influenced significantly our results, impacting its accuracy and reliability, paving way for future studies. Thank you.
A very nice study. I think the p-values seem to suggest that there was not much difference between the Surface Pro and the MacBook.
Yes, sir. Not much difference.
And actually what it seems to suggest is that it doesn't really matter what device you're using,
Yes.
but yes, the inter-test reliability
Yes, sir.
is better when you're using the same device.
Same device, yes, and also the same browser.
Okay.
What parameters actually were different in both the devices which you evaluated?
So the aspect ratio of both the computers were different, and also the screen resolution was different. We tried to standardize as many parameters as we could, but these 2 were the main reasons that could have influenced the results.
So that
Yeah,
would
it
be
could
like
because of a lot of neuroadaptive elements also coming into play.
Yes, sir.
So this thing is out there. It's really an interesting thing. His questions are very valid in terms of first thing is we're just talking about the ocular parameters. First is the display, because the displays are different.
Yes,
It is
sir.
not only that, the pixel densities are different.
Pixel densities.
The refresh rates are different.
Yes, sir. The
Yeah.
environment, the testing room, it is different every day.
And you've tested with different browsers, or it is the same? Yeah.
So for this study, we used the same browser, that is Chrome. I downloaded it on the Safari, on the MacBook Air. But we also tested, there was a separate study that we did where we compared browsers. So we did find difference in the browsers too.
So the good thing about the study is that, it shows that the more devices there are, the more they have to come back to us for validation of the devices.
Yes.
Thank you so much.
Thank you, sir.
Anybody has any questions?